Hi, I'm John Malos. Welcome to this live edition of Connect with Me on the showroom floor at Ventura TV. On this Monday morning, 9/11, certainly we're going to remember all the victims of 9/11, but today the main topic is health care. Health care right here in the Central Valley and the state of California. Is it changing again, despite the fact the Senate could not pass a health care bill? 436 Me TV option 11, Connect with Me starts right now.
Tonight I want to discuss the importance of the television medium to the American people.
And welcome back to the program here on Connect with Me on Me TV Fresno. We're broadcasting, of course, live from the showroom floor at Ventura TV as we do every day, Monday through Friday. But, you know, first I do want to talk about the fact that you are experiencing 9/11 all over again, because 16 years later we still have those vivid images in our minds. The Twin Towers coming down, of course, memorial services going on all over the country, including right here in Fresno, the Central Valley, out in Clovis, at Pelco, and of course around the nation. We should not also forget the Pentagon that went down in Shanksville, Pennsylvania, where the plane went down, headed possibly for the White House and the Pentagon on 9/11 16 years ago. So we remember all of the victims, nearly 3,000 of them who died 16 years ago on this day. For now, you're watching us live on Comcast, channel 375 as usual. It's Comcast cable. If you don't have Comcast cable, hey, don't sweat it, my friends. It's 43.6 and 13.1 over-the-air broadcast with a digital antenna. But here's the thing. The replay comes up also over-the-air broadcast. You don't need cable TV or direct TV or dish or any of those to watch the replays. 2 o'clock in the afternoon, 13.6 YouTube, 8 o'clock tonight, 4.6 Biz TV. And then, my friends, after that, you can go to youtube.com/MeTV Fresno, and then scroll down to the uploads icon, and you can catch all of our broadcasts on there. So again, we honor those victims who obviously died 16 years ago on this day. The Twin Towers coming down, the Pentagon attacked, and the plane going down in Shanksville, Pennsylvania. Today we're going to talk about health care. As you know, Congress is back in session after a long dry spell. They had a long month off in August, but here's what they have to deal with as they come back into session here this month, in the month of September. They got to worry about saving Houston, saving Florida, raising the debt limit, funding the government, keeping us out of a nuclear war with North Korea. How about tax cuts? How about dealing with racial divide and obviously discrimination in this country? And of course, health care. Steve Bannon, the chief strategist for Donald Trump, who resigned just recently, did his first interview yesterday or last night on 60 Minutes. He said this about health care. He said that you will not totally repeal Obamacare. However, if you listen to President Donald Trump, he has consistently said it will implode. Here is the President of the United States.
Disappointed. Very disappointed. I don't think it's dead, no, but I'm certainly disappointed. For 7 years I've been hearing repeal and replace from Congress, and I've been hearing it loud and strong, and then when we finally get a chance to repeal and replace, they don't take advantage of it, so that's disappointing. I've been saying that, Mike, I think you'll agree, for a long time. Let Obamacare fail, it'll be a lot easier. And I think we're probably in that position where we'll just let Obamacare fail. We're not going to own it. I'm not going to own it. I can tell you the Republicans are not going to own it. For so many years I've been hearing repeal and replace. I'm sitting in the Oval Office right next door, pen in hand, waiting to sign something, and I'll be waiting, and eventually we're going to get something done, and it's going to be very good.
Were these Republicans who came out against it disloyal?
Well, they were not disloyal. They had their own reasons. I was very surprised when the two folks came out last night, because we thought they were in fairly good shape, but they did. And, you know, everybody has their own reason. But if you really think about it, you look at it, and we have 52 people We had no Democrat support, which is really, something that should be said. We should have had Democrats voting. This is a great plan for a lot of people. So the way I look at it is in 18, we're going to have to get some more people elected.
Live in our studio right now is Bill Phelps, Phelps, I should say, the Chief of Programs for Clinica Sierra Vista in Bakersfield and here in the Central Valley. And so, Bill, welcome to the program. I'm glad you are here on this Monday morning. You heard what the president has said all along, that it's going to implode. Obamacare is going to implode. You know what happened with the Senate twice. They failed to pass a new health care bill for this country. Also, they tried to pass a skinny replacement plan for Obamacare, which was the third time around, I believe on July the 28th. That also came up short and failed. Last night, Steve Bannon said, hey, listen, guys, you're not going to totally repeal Obamacare. This came out of the mouth of Steve Bannon. Do you agree with that?
I do agree that the Affordable Care Act is going to be around in some form or fashion going forward. I'm not sure exactly what it's going to look like. But here in California, we have a very strong state exchange, Covered California, that has worked very hard to keep this going. And we have lost some of the insurers, including here locally in Fresno County. But I think there's stronger support for the Affordable Care Act now than there was prior to the election. I think people are realizing that Obamacare and the Affordable Care Act are the same, and that they themselves could be hurt greatly if this were to go away. So we're looking at between 20 and 25 million people that would have lost coverage under the Republican plans in both the House and the Senate.
All right, now you work for Clinica Sierra Vista. That is a San Joaquin Valley nonprofit corporation, and it serves the San Joaquin Valley. You're in Bakersfield, but you came up this morning. Obviously, you made the trip up, and I appreciate it. So I don't know if is it your coworker, Stephen W. Schilling? He wrote an op-ed piece in the Fresno Bee just recently talking about health care right here in the Central Valley and how Anthem Blue Cross is going to pull out. But first, before we get into that, talk about what your company does regarding health care.
Well, Clinica Sierra Vista has been around for about 46 years. We're a federally qualified health center, which means we do receive federal funding to help support our services. We also have a consumer majority board that runs the organization.
Right.
We provide comprehensive primary care services in underserved communities. And so we are there in the locations that need us the most. And where there's a shortage of medical professionals, that's another requirement for community health centers. So we're serving at least 150,000 people a year here in Fresno, Kern, and Inyo counties, and we're here to stay.
Hang on, caller. We'll get to you in just a moment here in just a second. Bill Phelps is here from Clinica Sierra Vista. And I will get to the phone call in a second here. The services that you provide, help me understand.
We provide primary care. So we have doctors and middle providers and nurses that provide health care services to mostly underserved, low-income individuals and families below 200% of the federal poverty level. Majority of our patients are non-Caucasian, 75% are Hispanic, Latino.
Okay.
And most of our patients either have coverage through Medicaid, or Medi-Cal, the California version of that, or they're uninsured, and that's part of where we get federal funding to help offset those costs.
And do you serve the San Joaquin, not only San Joaquin, but the Fresno area, Fresno County?
Yes, we have 10 health centers here right now with plans to expand in the near future, and we serve about 45,000 individuals here in the metropolitan Fresno area.
All right, we're going to get to the phone call. Good morning. You are on with Bill Phelps. He is the Chief of Programs for Clinica Sierra Vista, serving the San Joaquin Valley. What's your question?
There's something I don't understand. Why is healthcare the only industry that has the right to double charge you, such as deductibles and co-pays? Now, if you have something repaired in your home, car, or any place else, you only pay one fee. And that one fee is like I paid $40 to have my gas line fixed or something like that. But when in healthcare, you pay a monthly fee, then you pay a fee that is charged to your insurance company. The insurance company turns right around and negotiates a pre-cost factor, such as 85% or 15%, and then whatever is left, you have to pay another fee on top of that, and that is for co-pays. Yeah, to get a doctor wants another second dip at the number, so you have to pay them an extra $15, or you have to pay them an extra $30.
Yeah.
Why is medical industry the only one allowed to double and triple dip into our wallets? Why can't they be satisfied with the premium?
Stay
The
there.
premium is supposed to be,
All right.
monthly premium is supposed to be based on the fact that you have X number of people coming into your bill.
Okay.
And you either lower your price or raise your price according to your total membership.
Remain on the
I
line.
do not
Stay there. Hang
do
on.
not want any.
Hang on, caller. Hang on. Let him answer the question. Stay on the line. Let Bill answer the question. Go ahead.
Well, first of all, healthcare is very complex, as our president has said, and we don't have a single payer system in this country.
Right.
And that is what contributes to all these different costs. So particularly if you go and have a medical procedure, you're going to be paying each doctor, the anesthesiologist, the facility, the nurse. You're going to be paying for all those
Medicine,
individually.
if you take
There's
any kind of
co-payments, there's
painkillers.
deductibles, yes, your medication. It is a very complex system. It's much more complex than having your washing machine fixed or your air conditioning system fixed, where they give you an estimate, they come and do the repairs, and it's done.
But it does seem oftentimes like we are double billed for a lot
And
of reasons.
I think
and
we-
that's
yeah.
why you need to call and check.
And we've all experienced that. I mean, I had a procedure done some years ago, and I ended up getting like 6 different bills. I had no idea I'd be getting those. The insurance paid some of it. I had to pay some of it. Some of it was written off because the insurance company negotiated a lower rate. So
Yeah.
I don't have an easy answer. I know at community health centers, we really try to simplify things and giving people a single bill when they
Yeah.
have an expense. We bill their insurance. If it's Medi-Cal, they don't have any out-of-pocket costs at all.
My goodness. Hey, caller, you still there? Go ahead.
Oh yeah, I'm still here because this is all double talk. Okay, because like when you had the Obamacare or Affordable Care Act, that if you had a pre-existing condition, that was one of the reasons they had to get the government money. They had to get the people covered.
Right, but here's
And-
the thing, caller, are you there? Can you hear me, caller?
Yes, I hear you.
Okay, let me just explain something to you. I don't think Bill was giving you double talk at all. I do think that he's telling the truth about this because here's the thing. I recently had, 3 or 4 years ago now, I had a heart procedure done. I had 2 stents put in. I've talked about this extensively on the program since it happened, okay? I got a bill for the doctor who performed the procedure, putting the stents in. I got a bill from the hospital for using the facilities. I got a bill for all the medications that I had. I got a bill for staying in the hospital 2 or 3 days after the procedure was done. Then it's the doctors that were seeing me after the procedure. I got a bill from them. So it's like 3 or 4 different entities that I got billed for. Of course, the insurance that I had, thank God, knock on wood, I had insurance, but still, there are co-pays. So caller, don't you agree with that? Don't you realize that that is part of the healthcare system? And that's what's going on. I'm not saying I agree with it, but it's a fact of life.
Well, so is I have 3 stents in my heart.
Okay.
I have type 2 diabetes,
Okay.
and I also have lung cancer from smoking for over 40 years.
Oh my goodness.
So the bottom line of this thing is that when I say double talk, it's not against him because he doesn't negotiate the contracts with the government or anything else. But the whole system was like when I was with Kaiser, I had to have all that work done, and all that. And anyway, Kaiser went up $150 in 1 year. The next year they went up $51. Then the next year was supposed to be when Obamacare was supposed to come into effect, and you have preconditioning and all this.
Yeah.
I was told that the charity that was working for catastrophic illness was going to be increased to $6,000 copayment. And so,
Wow.
And I couldn't afford it, so I went to a government plan. Since I'm a retired government employee,
Okay.
I went to a government plan, and I only paid $200 and some odd a month for what Kaiser wanted. And I'm going to go back someday. I'm going to have to go back in for medical again. That at $6,000 copay is not going to get it done. So this idea of copay, like I say,
I don't think the
anything
$6,000 was a copay.
like
I think that was
your
a
shoelaces bust, you go out and buy a pair of shoelaces and you put them in.
All right.
You don't have to pay the company that makes the shoelaces again.
All right.
Anyway.
I appreciate you calling. I got to move along here and get some other callers in. Thank you for that call, and take care of yourself. You got lung cancer, type 2 diabetes, and obviously the stents put in. Listen, Bill Phelps is here, Chief of Programs, Clinica Sierra Vista, I should say, here in the San Joaquin Central California area. 436-MeTV option 11 with all of the issues on the table facing Congress, with the hurricanes going on, with the debt limit, with the war possibly with North Korea. Healthcare is still at the top of the mind of some people. 436-MeTV option 11, back in just a moment.
When you like Ventura TV Appliance on Facebook, it's nice. But when you love the Whirlpool appliances we deliver, it's even better. Our website is cool, and it's a good place to start, but you really should touch the merchandise before you buy. Touch the new Whirlpool Ice Collection. It offers a modern style made to create an inspiring kitchen experience. Save big on this Whirlpool Black Ice or White Ice kitchen. Come in to Ventura TV Appliance and touch the merchandise today.
Not sure what you're watching? Want to see what's coming up next? Or just want to browse what's on without the hassle of flipping channels? Your wish has come true. Now you can view schedules for all the digital TV channels available in the Central Valley. Get local weather updates and forecasts, and listen to nationally syndicated Biz Talk Radio, all on KVHF 4.1. Rescan your TV now, then tune in to digital channel 4.1 to start enjoying the all-new TV guide.
Is it safe to say, Bill, that Clinica Sierra Vista is a healthcare program?
It's more than a program. I mean, we're clinics.
You're
operate
clinic.
medical clinics,
So if I want
dental
to
clinics.
I want to go and see the doctor, I can go to your place.
We serve everyone. We really focus on those that are underserved, but we accept pretty much all insurances. We accept
Obamacare?
Obamacare. We accept the state Medicare or Medi-Cal and Medicare. We accept, and then for patients that are uninsured, we have a sliding fee scale based on income and family size.
Okay, here's what I want to get to, and you mentioned it when we saw the president, obviously, in the monologue, talking about how Obamacare is going to implode. His belief is that it will just self-destruct, all right? That is not the belief of everybody. Bannon said last night on 60 Minutes, you've seen it all over the news today, no, you can't totally repeal Obamacare. Stephen Schilling, your co-worker at Clinica Sierra Vista.
He's my boss.
He's your boss?
Yes.
Okay. He was scheduled to be here today, but he got tied up, and we're glad that you're here,
Yes, I'm
by the
glad
way.
to be here.
I am
Glad to
glad
be
that
here.
you are here because they say you're more of an expert, though, than Stephen.
I
But
would
here's the
not
thing.
ever say agree
Stephen,
to that.
your boss, wrote an op-ed piece in the
Yes.
Fresno Bee, and I found it fascinating, and I have to tell this to our viewers because it deals with right here in Fresno County. Anthem Blue Cross is pulling out of covered California in the exchanges in Fresno and Kern counties. What does that mean?
That just means one of those insurance carriers
Which
that
is
was
Anthem Blue
and
Cross.
that was formerly part of the affordable the
Covered
exchange.
California.
Covered California is no longer. They have just made a decision to pull out of most of California. They're going to be in some areas like Northern California, but not down here in the Central Valley. It means folks will have other options to look from. We're not in a situation where we're down to no other carriers. We still have Blue Shield and Kaiser here in Fresno County.
Okay, so does that mean that only your insurance card is going to change come when? January?
January 1st. Anthem will be here till the end of the year. And so the new insurance program will start on January 1st. For those about 7,000 Fresno consumers who have Anthem, they'll have to switch.
This is along the
Yes.
individual market.
This is individual market. This has nothing to do with people that get insurance through their workplace
Or
people
Medicare
getting
or anything like that.
Medicare, Medi-Cal. It's just though it affects about 7,000 individuals here in Fresno County. And so they'll be notified by Covered California. We're reaching out to those that we've worked with at our enrollment counselors to help people to switch to their plan so that January 1st they have continuity in their coverage and they'll be able to continue to see their doctor.
Okay, so no reason to panic, no reason for anxiety. Does the president, in his words, does he create this panic and anxiety along the healthcare industry?
Yes, I believe that his words have definitely caused a lot of uncertainty because he or the Republicans have not come up with a viable plan that's going to keep the same amount of people covered. He promised everyone would be covered. And it'll be better and more affordable than Obamacare. Well, I've yet to see that plan, and the Americans have not seen that plan. I think we all need to see a plan before you get rid of one set of services and benefits, and just let people, what are people going to do if they don't have coverage in the interim? Let's see what this wonderful plan is. I don't think he has one.
Okay, he doesn't have a plan, but Congress had a plan. Congress actually passed a plan. The Senate did not. And so obviously the Senate, it's a completely different body. It's almost like a foreign body compared to what the Congress is.
Right.
And so the U.S. senators rejected 2 plans, and then a third, a skinny repeal plan. People within Donald Trump's own party do not agree with what is happening. What does that tell you?
Well, again, how we address healthcare in this country is very complex. It's very politically charged. I think depending where you are on the political spectrum, everyone has a different idea on how it should be handled.
But can't we forget about the political spectrum and just worry about the facts, just the facts?
I really wish we could. I wish we could get Congress to get off the politics and look at what's going to be most effective for the American people.
So what are the facts? How can we do that? Is it single payer? Would that work? How would we lower the cost of Obamacare? Would repeal and replace work? What are the facts? What's going to work?
Well, first of all, insurance. We have insurance for our homes. We have it for our boats. We have it for all of our material objects. And the thing is, what brings those rates down is to have a bigger pool of coverage. So the more people that are covered for homeowners insurance, that takes care of if someone has a fire or they have vandalism or wind damage, that is taken care of. With health insurance, it works the same way. The broader the pool, the lower the cost. So the problem with Obamacare is we didn't get a lot of those younger, healthy people in. The penalty was too small. People decided, I'm just going to forego getting health care coverage and I'll pay the penalty. And so those healthier people did not get into the pool to help keep those costs stable and bring it down. So if you have just older, sicker people in the plan, it's going to drive the premium costs up. So the broader the risk pool, the better the price is going to be for the consumer. And so we have to figure out a way how to get everyone in and to make it more affordable for everyone, regardless if they're young and healthy or old and sick.
All right, I want our viewers to be well informed about what's happening here in California. So by the end of the year, Anthem Blue Cross is pulling out of Fresno and Kern counties. Those are the 2 counties that are close by here in proximity. Okay, so what to do if you're in the individual market, if you're one of those 7,000 people, what you have to do, how do you change over either into Blue Shield or Kaiser? Those are the only 2 options if you're under Covered California and you're in the individual market. How much time do you have? What do you do? How should you go about this? What do those people, talk to the 7,000 or a portion of them that are watching this show. What are the steps necessary that they need to take from this point on?
Well, the renewal process starts in early October. And so everyone...
It lasts until when?
And it lasts until mid-December. If you want your coverage to be effective on January 1st, you need to make your choice for what new plan you want to pick between early October, in about a month from now, through about mid-December.
Okay.
You can
before Christmas.
Yes, before Christmas, you really need to make that decision.
Okay.
Several letters will be going out to each individual that has Anthem coverage right now.
Who
Covered California will be sending out those letters.
Oh, Covered California.
Yes.
What will the letters state?
They will indicate that their insurance will be ending and that they need to select a new plan, and these are what the plans are in their particular region.
Okay.
And so the state's divided up into a number of regions. In Fresno, I think Fresno and Madera County are in a region. Kern is in its own region. And so they have to look at what's available in their region, and then they can make a selection. We also provide free enrollment assistance at our health centers. People can come and see us, and we'll help them select a new plan that is most affordable for them.
So you can go into Clinica Sierra Vista and help enroll in a different plan?
Yes, we are
Really?
certified
You
enrollment counselors, yes.
Oh, really?
We're certified through Covered California.
Okay, so give us some locations here just in the city of Fresno. What are some of the locations?
Well, at our Elm complex over on South Elm, we have
give it a cross street. Elm and what?
Elm and just south of Jensen.
Okay, Elm and south of Jensen. That's one location, and give us another one.
We have Garland.
Okay.
I don't have the
You didn't
addresses
bring
in
your-
front of me.
that's okay.
I didn't bring
That's
my
all right.
list of addresses.
That's okay.
Orange and Butler,
Okay,
West Shaw,
West Shaw. has
West
one.
Fresno,
Wow.
on West Fresno Street. At North Fine, which is where our administrative office is, we have a clinic there. We have enrollment assistance there.
So you can go in and get assistance from one of your Clinica Sierra Vista locations, and they will help you re-enroll between
Yes.
October and December.
Yes.
Okay,
For
and-
free, no cost. There's no cost to
okay.
get assisted.
All right, but you only have two choices, and it's going to be Blue Shield or Kaiser.
Yes.
What's the difference between the two?
Well, Kaiser is a closed system. It's an HMO, so you have to go to one of Kaiser's clinics and their hospital facility,
And you have to use their doctors.
and you have to use their
nurses.
doctors. Versus Blue Shield, you can use any doctor out there, including Clinica. We could only take Blue Shield. We can't take Kaiser. And so if you want to continue going to Clinica Sierra Vista, you'd have to pick Blue Shield.
Is Blue Shield similar to Blue Cross?
They're very, very similar. They all have to provide the 10 essential health benefits.
What are the 10?
Well, that includes being able to doctor visits, hospitalization, emergency room, prescription coverage.
Physicals.
Yes, physicals, prenatal care, behavioral health services, including substance abuse.
Pregnancy.
Yes, pregnancy coverage. All those are requirements of the Affordable Care Act. They all have to cover those same
Those
10
are the
health
10
essentials.
essentials.
Yes.
Okay.
That's
All
And there's no lifetime or annual limits,
All right.
which is an important part of the Affordable Care Act.
Bill Phelps is here, Chief of Programs for Clinica Sierra Vista here in the Central Valley, including Bakersfield. They have, how many locations just in the city of Fresno alone?
We have 10.
You have 10. So all you have to do
Rapidly
is
growing to about 17.
growing to 17, go to Google and Google Clinica Sierra Vista. You can go to one of those clinics. They'll re-enroll you as far as Obamacare is concerned if you're under the Affordable Care Act or Covered California. It's right here in the Central Valley and California. 436-MeTV option 11. We got an open phone line. Back in just a moment.
The new Frigidaire Professional line at Ventura TV Video Appliance. Enjoy generous-sized cooktops and saute or simmer with ease, while true convection ovens offer even baking and juicy roasting perfection. Foods stay their freshest in spacious refrigerators with convenient controls and clear filtered ice and water. Easy to clean surfaces reduce fingerprints, and the quietest of dishwashers makes cleanup a snap. The new Frigidaire Professional line at Ventura TV Video Appliance.
This is a major defeat for this president and the Republican Party after campaigning for 7 years on a promise to repeal and replace Obamacare. In this critical moment, they couldn't get it done. And it was Senator John McCain, the self-proclaimed maverick, who delivered the final blow.
The motion is not agreed to.
High drama on Capitol Hill. In a shocking vote early this morning, Senator John McCain delivering a death blow with a surprising no vote as Senate Republicans failed in a make-or-break effort to repeal Obamacare. Yes, we did! The vote drawing cheers from demonstrators outside the Capitol. Inside the Senate chamber, Majority Leader Mitch McConnell appearing stunned by the result.
This is a disappointment.
The so-called skinny repeal bill opposed by every Senate Democrat, along with 3 Republicans, Senators McCain, Susan Collins, and Lisa Murkowski. The bill failing despite last-minute wrangling from fellow GOP senators and Vice President Mike Pence. President Trump tweeting his disapproval. 3 Republicans and 48 Democrats let the American people down. As I said from the beginning, let Obamacare implode, then deal. Watch. Just days after his dramatic return to the Senate after brain cancer surgery, McCain getting cheers and applause from Democrats after casting his vote. Later explaining his decision.
I thought it was the right vote.
Another no vote, Senator Lisa Murkowski telling NBC News.
I believe each of us stood up for the reasons that we felt were right.
The vote coming just 3 hours after the legislation was made public. Democrats railing against the bill at every turn.
This process is an embarrassment. This is nuclear-grade bonkers, what is happening here tonight.
How do you improve health care in America when you throw 16 million people off of the health insurance they currently have?
Adding to the drama, Republicans insisting they didn't want their bill to become law, instead hoping to open negotiations with the House, working to win over their wavering colleagues until the last minute. McConnell ultimately conceding defeat and taking aim at Democrats.
So I expect that they are pretty satisfied tonight. I regret to say that they succeeded in that effort. So now I think it's appropriate to ask what are their ideas.
The Senate's top Democrat, Minority Leader Chuck Schumer, getting emotional, talking about McCain's decisive vote.
And let's turn the page in another way. All of us were so inspired by the speech and the life of the senator from Arizona.
All right, Chuck Schumer, the Democrat out of New York, getting very emotional about John McCain, who was a Republican out of Arizona fighting brain cancer. Our thoughts and prayers to him and his family. But of course, you know, he struck down this skinny repeal bill on July the 28th. Does this mean, I don't know what you're hearing within the industry. You're probably hearing different things than I'm hearing because I'm not in your industry. So within the healthcare industry, what are you hearing? With all I mentioned right at the top of the program, look at all of the issues that Congress has to deal with, all these hurricanes, the debt limit, so on and so forth. Are they going to tackle the issue of trying to repeal and replace Obamacare again? What are you hearing?
I don't think they're going to be able to come around to this issue in the next few months. I think, like you said, there's too many things on their plate right now. We also have a big issue for community health center funding to address before the end of this month.
Talk about that, because the deadline for what you just said is September the 27th. What does that mean? Explain it.
Community health centers receive a significant amount of funding from the federal government in order to help provide comprehensive coverage for those that are underserved and uninsured, underinsured.
How much does your organization receive from that federal funding as a nonprofit?
We get about $24 million.
And Donald Trump wants to cut that?
Funding, and it's a total of about $5.1 billion for the industry.
Wow.
There's 1,400 community health center organizations across the United States operating 9,800 health centers, like Clinica. We're looking at a 70% cut in our federal funding, which would result in nationwide about 9 million individuals losing their coverage. We'd be losing, here at Clinica, $16 million.
What would that do to you?
Well, over 30,000 patients of ours would lose coverage because we'd have to cut back hours, possibly close some clinics, lay off some staff, because we would not have the resources in order to keep all these facilities open.
And some of those people that you serve within the San Joaquin Valley would have zero coverage.
They'd have no place to go because there's no one else that can absorb that many patients.
Okay.
So it'd really
again,
be...
Again, you receive about $20 million?
$24 million.
$24 million.
Be cut by 70%. That's a $16 million cut.
$16 million cut. And so you can't function on $8 million.
We can't function on... We do get patient revenue, but it would be... we would have to cut our patients by about 21%. So it's the combination of our federal grant, the reimbursements we get through Medicare, Medicaid, and some small donations, as well as the self-pay that some of our patients make. Mm-hmm. It all comes together to make a complete budget. This cut of $16 million would be a significant impact on our organization and across those other organizations across this region. There's others. There's Valley Health Team and United, and others around the valley that would be impacted significantly. We'd all be impacted.
Yeah, I've spoken to the person that heads Valley Health Team. They're a clinic just like you guys
They're
are.
just like us, a federally qualified community health center.
Right, and they get about how much? The
I
Valley
do
Health
know
Team?
know how much
Roughly
the other
speaking,
organizations.
Do they get less or more than?
We're one of the largest in the state, so they probably get significantly less than us. But it's going to, for every one of these health centers, it's going to be millions of dollars lost and thousands of patients that will not have access.
Okay, so September 27th is a deadline. Is there a bill in Congress right now to reduce these funds?
There's not a bill to reduce them. It's that part of the funding is expiring. It was originally part of the Affordable Care Act, and then it was renewed for 2 years under a bill called MACRA. That was the Medicare Access and CHIP Reauthorization Program. CHIP is the Child Health Insurance Program.
Right.
That's also ending at the end of the month. So what we're trying to get is Congress to pass a bill that would cover the health center funding, the children's health insurance. Also, along with the health center funding is the National Health Service Corps, which is the loan repayment program for the doctors that often come to work for us, as well as the teaching health center. We run a teaching health center in Bakersfield.
A teaching health center for doctors, nurses?
Yes, for residency, for family practice doctors too.
Okay, let me ask you a question. So September 27th is the deadline. That's when the funding runs out. So what has to happen before that? Does Donald Trump have to take action? What has to happen?
Congress, both the House of Representatives and the Senate, must pass a bill that reauthorizes this $3.6 billion in funding for community health centers, along with the Children's Health Insurance Program, CHIP.
Mm-hmm.
Those have to happen and then have to be signed by the president. We have great bipartisan support.
This is 9/11.
Yes.
You're talking about the deadline is September the 27th when the funding runs out. That's not going to happen.
Well, we're going to try to make it happen. We need everyone to get on board. Call
how do they get on board?
They need to call Congress. They need to call we need to call our U.S. senators. We need to call our U.S. representatives here in Fresno County.
Obviously, it's Costa. You got Valadeo here. You got McCarthy, Nunes. And then you got Feinstein and the senators. Harris, that's right, Kamal Harris. So call your representative right here in the state of California, the 2 senators, and your local Congress people. And I know that our state, we go all the way up to Los Banos and down into portions.
This is
of
going to affect the
Bakersfield.
entire country.
It's going to affect the entire country with all these clinics around the country. September 27th is the deadline. And so if it doesn't get done, what happens on September the 28th?
Well, then I think all of the health centers around the country, they probably already have in place some kind of preliminary plans of what's going to have to happen.
Temporary.
It may not happen like overnight, but over the next several months, we're going to have to look at how we're going to have to scale back services when we have this massive loss of federal funding.
Could the president sign an executive order to give you a temporary stay, like a carryover until Congress deals with this?
The president doesn't have authorization to extend funding.
Okay.
He can change policies and procedures, but he can't enact funding.
If he could, do you think this president would?
Oh, if he could, he probably would do a lot of things, yes.
Yeah.
But he doesn't have that power. The president doesn't have the power just to authorize funding. It has to go through Congress.
What's your backup plan for September 28th at Sierra Clinica Vista?
Well, we will have to be informing our patients that that our ability to provide services will be impacted. We have to be honest. We're being honest with our staff. We're telling our staff, call your congressman. Let your congressman know how this is going to impact our patients and their jobs.
So you need to get the word out. See, there are very few people that probably know this. So you're coming on our program today to let our viewers
and yes,
know.
And this is really important for the viewers to know, especially whether or not you get your care through a community health center. If you care about health care for this community, we need you to contact your congressman and let them know they need to act now.
And you can look up those numbers again online. And so if you're cut by $16 million, how many clinics do you suspect you might have to close?
Well, it may not be necessarily closing clinics, but it's cutting back hours. A lot of our clinics are open Saturdays. We'll have to have fewer clinics open on Saturdays. Some of our clinics are open 10 hours a day. They'll be, or 11 hours a day. They'll be cut back to 8 or 9 hours a day.
Okay, so you may not necessarily close clinics.
Well, we may have to look at a few of our marginalized health centers, and unfortunately, where they're serving fewer people, that's going to be in some of the most rural areas.
My goodness. And go ahead.
Because we serve, in Kern County, we serve not just metropolitan Bakersfield, but we serve a lot of the farm communities like Arvin, Lamont, Delano, McFarland, Kern River Valley.
Yeah, got a caller here. Go ahead, caller. You're on the air with Bill Phelps. He's from Clinica Sierra Vista. And what's your question this morning?
Well, it's more of a statement. I've never had insurance my whole life until I qualified for Medicare Medi-Cal. And I thought it was a foolish thing to put our medical system in the hands of the insurance companies who can raise premiums, as you know, and make people lose their coverage. I've always gone to clinics my whole life until I qualified for Medicare Medi-Cal. And my opinion was that instead of doing it through the insurance companies, the Congress or the government should have given a United States clinic card so people could go to the clinic of their choice, and the clinics would be billed and paid to that. The government would pay the clinics.
Yeah. Go ahead, Bill. Hang on, caller.
That's an interesting concept. It's not one that I've really heard discussed. I know that, again, when we have private insurance that's operating most of the healthcare system in the United States, they're for profit, so there's profit built in. We've heard a lot of talk about the huge pay and bonuses that the executives in our insurance industry have been receiving. And so the Affordable Care Act has required insurance companies to spend at least 80% of their funds on actual coverage.
Yes. Caller, are you still there? Any other comment or question for me?
Yeah, see, they're always talking about a single-payer system, but that doesn't work in the United States like it does in Canada and the UK because the governments own the medical system. Nobody owns the medical system. There are a bunch of conglomerates, a bunch of corporations, a bunch of doctors who have gone in, and so we can't have that type of system here.
Do you agree with that?
Well, I mean, the Medicare system is a single-payer system.
Right.
It does have, you have, you can get additional coverage through a private insurance carrier.
Right.
The senior care type programs, which are through, but the basic coverage it's paid by the government, but it's run through private and public organizations, profit and nonprofit.
Right. Now, caller, let me ask you a series of questions here while I got you on the line. Are you on Medicare? Are you too young for Medicare? If so, are you on Covered California? Are you in an individual plan? What's your health coverage right now?
I'm on Medicare Medi-Cal.
Say that again. I didn't hear it.
I'm on Medicare Medi-Cal.
Gotcha. Okay.
It's typically someone who's under 65 that has a qualifying disability and is low income. So usually with that coverage, it helps to, in some cases, to minimize the out-of-pocket costs, so that an individual can have coverage for their medical condition.
Right.
And it's usually a permanent disability. It's usually someone who's going to be a long-term disabled person.
Caller, go ahead. Crank him up.
Right. Well, the problem is that Medi-Cal doesn't cover procedures for dental. I have to go to my clinic here in Early Mart, which is where I live, and I have a copay of $20 per visit, and that's where I have my all the Medi-Cal pays for is the exam, and then when it comes to the procedures, I have to pay the $20 each visit.
Straight Medi-Cal does have dental coverage. I'm not that familiar with the dual eligibility coverage. I know that we provide dental services as well, but there could be a co-payment when you're a Medi-Medi because your income may be a little bit higher, and they require a co-payment for the procedure.
At Sierra Vista, you don't have to be low income. Anybody can go in.
Anyone can come. We welcome anyone in our doors.
Yeah. Caller, I appreciate you calling. Any other comments that you have there? Go ahead and turn them up.
Yeah, it's not a copay. It's a sliding fee scale.
What's that again? Well, it's a sliding fee scale. Thank you, caller.
Early Mart is a community health center.
About dental?
Yes, dental services. There's also a sliding scale for dental services at a community
sliding
health
scale
center
for everything.
Yes.
Oh, so the program that he has, the coverage that he has now, it's a sliding scale.
Yes, I'm surprised though that he doesn't have dental coverage under Medi-Cal. Medi-Cal does have dental coverage, but without having him talk to one of our enrollment counselors, but he's at another health center, he could talk to one of their enrollment counselors to find out if he's getting the full benefits of the coverage that he has.
Yeah, so like your organization, the Clinica Sierra Vista, the Valley Health Team, they're another one. You can find one in your area, but Clinica Sierra Vista is here today. They have places all over the Central Valley, including 10 centers right here in the Fresno area, right here in the city proper, as they call it, the city of Fresno. 10 locations, and hopefully they're going to get this federal funding they need by September the 27th. No guarantees. Call your local representatives. That means Congressman Costa, Valadeo, help me out here, Nunes, McCarthy, and then Feinstein and Kamala Harris, the two senators that are represent the state of California. So a very informative program coming from the healthcare perspective today. If you have any other questions, anybody can call in. We have an open phone line, 436-ME-TV, option 11. We'll come back and talk about a very important bill that's going through Sacramento right now, the state assembly, the state senate. How is it going to impact the Central Valley? Back in just a moment.
Want to create something extraordinary? Create perfection. Our lifestyle appliances make it easy. KitchenAid, Ventura TV appliance, and you, when only the best will do.
When you like Ventura TV Appliance on Facebook, it's nice. But when you love the Samsung big screen we deliver, it's even better. Our website is cool, and it's a good place to start. But you really should touch the merchandise before you buy.
Time for that upgrade to an HD 3D web-enabled Samsung TV.
Get the best selection, price, and service in town without waiting. Come in to Ventura TV Appliance and touch the merchandise today.
Back here on the program, and Bill Phelps is here. Glad you're here, Bill.
Thank you.
Clinica Sierra Vista. A lot of people may not have heard of that, but a lot of people have, and so we're glad you're here to inform our viewers. We got a call here that just came in, so caller, you're on the air with Bill Phelps. Go ahead.
Hi, Bill. How you doing?
Doing good.
Good. I use your offices, the one on Garland. I was disabled about, I think, in 2010. And I have Medicare. They gave me Medicare automatically, and they gave me Medi-Cal automatically. So I guess after the second year or something, they took the Medi-Cal away, and I have to went and reapplied, and they said that I have like a $1,400 copay. Is that worth going to get again? Does that help in any way?
I believe what you have is what's called a share of cost Medi-Cal, and that's not what you're going to have to. If you go to our clinic, that's not the payment you're going to. You're not going to have to pay for the full amount of the payment. But I believe it's a little bit more complicated. I'm not really an expert in this in how this type of Medi-Cal works. We normally work mostly with full scope Medi-Cal, but it's based on your income and your resources, and so there is what's considered a share cost. So you may have to pay some out of pocket, but you can talk to one of our enrollment counselors at our health center that could probably give you some information on the details. But yes, I think it would be worth your while because Medi-Cal covers some things that Medicare does not, and so you really want to have both coverage. And so I think it is worth your while to look into that.
Even though, because I had another, I see a specialist too, and he gives a deal if you have Medi-Cal, just if you have Medi-Cal, and that's it. So that would be one plus. But it's just everywhere else they ask, you have Medi-Medi. Well, I could get it, but I have to pay, X amount of dollars, which is way over my budget. So I just didn't understand that.
Like going to see the doctor, it's going to cover most of those costs. So it's still worth it for your regular doctor visits. It would come into play when you probably had a major procedure or hospitalization.
Yeah. All right, caller. I appreciate your time very much. Quickly, we're running short on time. Anything else, real quick?
Nope, that's it. You guys have a great day.
Thank you. Thank you so much for calling in and trying to inform the viewers today about the healthcare situation. Is it possible to have a healthcare system in this country, okay, whether it be single payer, I don't care what it is, covered California, whatever the Republicans are wanting to do, is it possible to have a healthcare coverage where it's going to lower the monthly premiums, lower prescription costs, lower the deductibles, the co-pays to the doctors? Is it possible to have any kind of plan like that? Or are we just I mean, am I still living in the 80s?
Well, I think a couple things have to happen. First, like I mentioned before, you have to cover the entire risk pool, from the young and healthy to the old and disabled. That's one way of keeping those costs down.
Okay.
The other thing is for us to focus more on preventative care, to keep people healthy to begin with.
Have we not done that?
Not in the United States. We've done a very poor job of that compared to most
Why?
other developed countries.
Why?
I think that's the $64 million question.
Bill,
Why we have
listen.
not done that.
Listen.
We should be doing that.
I'm sure you've been overseas many times, as I have. Okay, other countries. I'll just give one. Europe. Okay, you've been to Europe, obviously.
I have not been to Europe, but
Okay.
I've been to Cuba, where they
Okay.
have a much better healthcare system for a lot less.
That's what I hear. I keep hearing that, but
They're very healthy.
But you talk about preventative care in Europe. They smoke, they drink, they party, they have a great time, and you know what? They live longer than we do.
Well,
You want to explain
I
that
don't
to
know.
me?
I think the smoking rates are probably not as high as they are in some areas of the
I
United
didn't go any
States.
place in Europe where they didn't smoke. Indoors, outdoors, anywhere they wanted, to airports, wherever they wanted. So I don't know. They're living longer than we do. It seems to me.
Well, I think, I mean, I have to look in the mirror when you talk about this issue, but obesity is a huge issue in this country.
It is.
And that's one of the leading causes of premature death and illness, chronic disease in this country.
Is it childhood obesity?
It's child and adulthood obesity. We have kids that are overweight from birth practically.
Yeah.
And the kids are less active. Everyone's on their cell phone, including adults. I mean, we have to get back out there walking, being active, eating healthier, not smoking. Those are important things if we want to live longer.
I'm not disagreeing with you. I'm totally in agreement with you, 100%. We need to take better care of ourselves. We keep putting it off, though. Tomorrow.
It's so easy to do. I'm as guilty as anyone on that.
I know. I got to take a break. We're going to come back for our final segment here with the one and only Bill Phelps. He's from Sierra Clinica Vista. Back in just a moment.
The following is a list of celebrities you will not see on MeTV programs. Charlie Sheen, Lindsay Lohan, Snooki, Paris Hilton, Perez Hilton, Honey Boo Boo, Justin Bieber, Simon Cowell, Chris Brown, Miley Cyrus, and the Real Housewives of any place. This is who you will see on MeTV programs. Lucy, Ralph, Mary, Perry, Gilligan, Kenner, Spock, Batman, Rowdy, Festus, and the Beaver. MeTV. Thanks for watching.
Back here with Bill Phelps. I want to talk about AB 1250. It's already gone through the Assembly. The Senate could pick it up here in Sacramento. I'm talking about the state system here, the state local political system. AB 1250 seeks to hamstring county government officials from exercising their duty to provide the best services available to their people. That's it's jargon that people may not understand. Speak to us in normal terms. What does that political jargon mean?
Well, for many decades, counties and cities have contracted with nonprofit organizations to provide essential health and human services to at-risk populations throughout the community, from homeless,
like drug dealers or users,
people that are substance abuse treatment is a big one that's run through
How about
nonprofits. Mental health services, we're a big provider of those services, both in Kern and Fresno counties. Preventative and intervention services, case management services for family at risk of abuse and neglect,
So
homeless services.
If this bill passes, what happens? Those services
It
go
makes
away?
it very difficult for nonprofit organizations like Clinica and the thousands and thousands of them across the state to actually contract with county and city government to provide these essential health benefits.
That's separate from the federal funding that you're wanting to receive.
Yes, that's totally separate. So that would really impact services like mental health services,
Okay.
substance abuse treatment,
Gotcha.
case management services for not pregnant parenting teens, that's state funded, but for families at risk of child abuse and neglect, for funding through First Five, Fresno, First Five current. We receive a lot of programs.
Why are lawmakers in Sacramento wanting to do this then?
Well, this has really been pushed by the unions to increase the union membership of the counties and cities. The thing is, when they hire more people, they have more liability to the counties, the higher benefit rates. The retirement alone would bankrupt our counties.
All right, let me talk about the bill's author. His name is Reginald Jones Sawyer, a Democrat out of Los Angeles, pushing this bill.
Well, he's formerly part of the SEIU.
A union.
A union. And this is really placing unions and nonprofits who typically are on the same side of the political fence.
Not this time.
But not this time. And what's interesting is that there's literally every county organization, whether it's the Board of Supervisors, it's the Chamber of Commerce, it's all the county associations, it's all the nonprofits, are against this because it's going to really cut into our ability to provide these essential services to those in our communities that most need it.
All right. In Fresno, I want to mention this because I read an article just last night that Clinica Sierra Vista and Fresno Unified School District are working both together to place healthcare centers on campus. It's a partnership between Fresno County, Clinica Sierra Vista at Gaston Middle School, not too far down the street from here, which sends students in need of care to the school-based health care center to be treated immediately if they have a problem. So that's the kind of program you're talking about, am I right?
Yes, we're planning to open up 6 new health centers in Fresno Unified School District.
6 new ones, and you have how many now?
We have one, and
that's at Gaston Middle
School. And we're going to open ones at Adams.
Okay.
I'm not sure if that's a middle school or an elementary school.
I don't know. I think it's an elementary
But
school.
we're going to be opening them on both elementary, middle school, and high school campuses throughout the Fresno Unified School District.
So if a child has an immediate problem, like let's say they're having anxiety problems, mental problems, whatever, boom, they can receive
those services.
access.
Yes.
Immediate access is what and it's a partnership between the county and the school district and Clinica Sierra Vista where they can provide these immediate services. And you're saying that the state of California lawmakers want to sever the ties.
Well, they want to make it so difficult that it's impossible for us to have these kinds of agreements with governmental organizations. And so,
do they see a conflict of interest? Is there a conflict of interest here that I'm not seeing?
I'm not sure. We're really depending now on the state representatives to not pass this bill.
But what is the other side saying? Are they saying, yeah, there's a conflict, we need to sever the ties?
Well, I think they're just wanting to increase the roles of unions. They're claiming that there needs to be more transparency and more accountability. There already is a tremendous amount of accountability. When we go and apply for these programs on a competitive basis, we have to submit all of our audit information.
Yeah.
We're subject to all kinds of site reviews and on-site audits, so there is plenty of transparency already. This is just a smokescreen to really increase the number of union members.
Now, if a child at, say, Gaston Middle School or any other school has a problem as a part of this service, will they be charged anything?
Typically, there would not be a charge because almost every child is eligible for either Medi-Cal, the state Medicaid program, or private insurance. Or some arrangement we would make with the schools to make sure that their coverage was free to minimal.
Okay, Bill, out of time, but I'm so glad you came to inform us. And,
Thank you.
If somebody wants to contact your clinic real quick, we have less than a minute. Quickly, give a phone number out. Bakersfield headquarters is what?
661-635-3050.
All right. Bill Phelps, Chief of Programs at Clinica Sierra Vista, thank you so much for being
John.
here. And come back again.
I will.
All right, that's going to do it for us today. Remember the victims of 9/11. Hey, tomorrow we have he's kind of a co-inventor. talking about the portable tabletop extension. He's a return guest. He's got a new update for us tomorrow on this program. And we'll see you then. Have a good day.